Let us share the screen and we can see the first. So if you can, Priya is joining us.
Yes, ma'am, we can see the screen.
Is it full screen?
No, ma'am. It is not full screen.
No, ma'am.
And now? Is it full screen?
No, ma'am.
No, ma'am, not now.
Okay, let's try one more time. So like, So what about now?
Yes, ma'am. Now we can see the full screen.
Yes, ma'am.
Okay, good. So you see that today we are starting the new unit. This is unit 7, and it's called Parents and Young Children. And this is about just caring children and so their diseases and how to take care of them. And here on the first slide, you can see 2 pictures. The question is, what is happening in each picture? And how do the adults and children interact? So who would like to describe?
Ma'am, in the first picture, like the lady is rushing a child to the hospital.
Yes, okay. They were taken to the hospital by the
Ambulance.
ambulance.
Emergency service.
And in the second picture, like the doctor is explaining a disease to the parents about the little fish.
And where is the doctor? Is he in the hospital?
No, it seems it's home visit.
He's visiting the sick child.
Yes, ma'am.
And
Yes,
how do the children feel in these situations? In the first picture, picture A.
In first picture, the child
Frightened,
might be
maybe.
thinking scary or afraid, like what's going on.
The child,
But in
the child seems
second,
panicked.
in second
In the second
picture,
picture,
the
like,
child is very
He's
comfortable and
playing like
it's home.
Yes.
Playing game.
She's a tease. There's something wrong with her hand, I see, right? But she's okay.
Yes, ma'am.
She's feeling safe and comfortable.
yes,
And so the parents also feel comfortable. And in the first picture, the situation is unusual for a child, but anyway, so the child feels safe because so this is a boy, I think, he's together with his mother, right? So, but mother maybe is worried about something, yeah, about his condition. Okay, and if we move to the next slide, so let us look at picture C. What is happening here in picture C?
Doctor or nurse
The
is
doctor
trying
is
to
injecting. The nurse is
injecting,
injecting.
So,
and the child is afraid.
yes.
So
Afraid from a syringe in the first
Yes.
picture.
He sees a syringe and he is scared.
Yes.
Okay. So, and okay, what about his mother? What is she doing?
Like he's holding the his son.
She is holding and maybe she's encouraging.
Yes,
Yes.
exactly. Well, A, B, C, D. Now picture D. So where are
In
the?
picture D, it seems like the doctor or they're showing the medical history of the.
Yes.
They're talking about patients, child's condition to their parents. Doctor is
If it has
talking
happened before or not.
And
condition or
He's having some
might
type
be
of fracture.
Before
Like,
that.
Yes, injury on hand.
Yes,
Something like
Samhita.
they are maintaining a record.
Samhita.
yes.
In this, ma'am, in the D picture, there's a possibility that the doctor is explaining something to the mother about the child's current
Mhm.
condition, or maybe a routine how to take medicines.
Okay, and how does the child feel?
The child is perplexed and numb about what's going on.
Mhm, mhm. And
The child looks calm, but still he seems to be tensed.
Yes, ma'am.
is he worried?
Yes, he looks worried.
Yes.
Mhm.
A bit worried, ma'am.
I see. Mhm. And in picture E, what is happening here?
In this picture, like the patient
Patient
is
is
severe and
serious.
the
Parents are
Parent
family
is
of
worried.
the patient
waiting
is
for
feeling
the
distressed
recovery.
or tensed.
Mhm. Yes, his father is stressed, and so
Yes.
the child may be in coma or just sleeping, but a very serious condition as we
Yes, serious condition.
Yes, ma'am, it's coma.
see. Okay, and where are the children at ease here in these pictures? So which picture are the children at ease?
Second, like in the second picture,
Picture
Second.
B.
like the children is
Picture B.
They're at their home, ma'am.
And maybe picture D, right? So
yes,
Yes.
we can see.
mhm. And why is yes, we can see that if children see instruments, they may be intimidated, right? Maybe scared or in panic, like
Yes.
we see.
Mm.
The same about parents. Mhm. Okay. And here the question is about the environment. The environment for treating children needs to be made different from that for treating adults, right? So,
Yes, ma'am.
Prerna, why? What do you think?
Ma'am, the environment is made different so that children can be treated more accordingly, so that as children don't know much about the medical procedure, so if the doctors or nurses or whoever there is, if they make them comfortable, then it will
Mhm,
be easy to coordinate with them.
mhm.
So
Okay.
for better
Like
coordination, they do such they have some toys and some cartoons or drawings in the room. And first of all, they play with the child and they ask their name. So all they do for the better coordination with the patient.
Okay,
they
great.
need more understanding. Like
More, sorry,
you
what?
can't explain anything to them directly. So
Ah,
instead of them like treating them well
mhm.
and like continuing the process, medical process,
So sometimes
like
it's
different
not
from the
easy
adult.
to explain something to a child because they are very little child.
Sometimes
Mhm.
like
Children basically don't understand anything about the disease or something. So, uh, to not get them scared or stressed or
mm,
frightened, it is important to distract them with some kind of toys or something. And
Exactly.
so
Mhm.
then, yes, they can treat them
And
like
by
injecting
distracting
a
them with
toddler.
something adventurous.
So
Mhm.
a doctor needs to like treat differently
As
of
children
the
are
children.
The doctor,
afraid of hospital, so
Mhm.
if they come and if they
Medical
are
stages.
scared or anxious or anything, then it will be easy for them if they make them comfortable.
Okay. And so we are speaking about environment. I mean, the place where they come when they are in the hospital, for example. And so the example is here, the toys, you mentioned this. And what about the ward? I mean, the room where they stay. So what would you recommend, how to organize everything in the room? Should
They
the room
should
should
have
be
more
very
Room should be
playful.
toys.
Different
room
from
should
that
be
of
As I
the
said, that if they
adult.
have
room
more
should be
cartoons
colorful,
or
Yes.
Colorful, playful with many toys.
colorful,
Yes,
playful, and they found it
Too much
very
toys,
interesting.
ma'am.
yes,
Mhm. Okay, great.
with toys, and some different things.
Bright colors here. Mhm.
Yes,
Okay. So, yes, Samhita would like to add something.
Yes, ma'am. Ma'am, the waiting area or the corridor can have those little swings and stuff. And ma'am, when we are talking to the child, we can actually, as we know that the child's heart rate is a bit higher than adults. So when we are talking to them for taking their BP, we can talk about their favorite cartoon shows or in which standard they are studying. So that
Yes,
the child don't get nervous.
yes. So,
by distracting them.
yes,
Yes.
the child should know that the doctor is interested in him. Mhm. Okay.
Yes.
So and so there is some statistics here on this slide by the United Kingdom that parents who are patients who are less than 15 years of age make up 20% of the average GP practice in the United Kingdom. So young patients 20%. And the under fourth patients consult their GP more than any other age group except the elderly. So, and the question, is this pattern the same in your country? What do you think? I understand that you do not know the exact statistics. Yes, Prerna, please. How can you
Yes,
comment?
ma'am, we don't know the exact statistic, but it depends who has more serious condition. But elderly have most of the diseases like diabetes and some joint pain, so they need regular checkup. So in my opinion, I think elderly are the one who goes
Mhm.
more to clinics or
No,
hospitals.
Okay, Samhita.
but beside,
Either, ma'am, if we talk, I don't know about the exact statistic, but at least in hospitals I have seen either they are completely elderly people or they're completely infants. Like there was this one kid who, especially the cases of TB and other diagnoses are more often in the young kids of 1 to 3 year olds.
Okay,
They
yes.
but I think, ma'am, I think it's about like if we see, yes, we know that elderly people have more amount of issues as due to age factor, but I also think that children below 4 years or something, they are because they go to doctors because in young children or something, we don't really understand what is exactly with the problem with them because usually they don't speak properly, so they can't speak and tell what is happening to them. So it is like I think child patients are more.
Mhm. And
But
their parents
They
are
have different
They're
worried
hospitals,
about
like
them.
but ma'am,
individual hospitals
child
have.
patients are less prone to diseases or any disorders, so
But
they
it's
have
not
some
talking about
minor fever or
they are
something.
prone or something. It's like what my opinion is that they cannot describe their own unease, so it's more likely to for
Have
them to go to
patients.
But
hospital.
uh,
Yes.
that is okay.
And
But in most cases, it does not happen. They only have some stomach ache, and they say that I have some headache or this is paining, that is paining. I'm feeling this and this, and when they go and check, then it comes out some
Yeah,
minor
it's
thing.
minor, but who are more
they are
likely to
patients,
go
they
doctors?
consult, yes, the general
Even in my
practitioner.
opinion, under four patients are more, ma'am, because it's about
Yes.
about the risk, ma'am. Like parents
Mm.
don't want to take any risk and all, ma'am, in this
Uh-huh.
underage.
Actually, this question is asking about who is more likely to go to doctors.
Yes.
So I think children's because
Yes.
as they
Their
cannot describe
parents.
their own unease, so it's more likely if the child what the child does is only cry. He cannot say anything that what he's feeling. At
Yes.
least it
And the parents may be
more
worried, so
likely.
like
Yes.
they visit the
So just
GP.
they run to hospital with their children,
Okay.
parents.
Okay. Yes, Samhita would like to say something. Yeah.
Yes, ma'am. Ma'am, nowadays, especially after post lockdown, that what I have seen is that the external factors are also being affected in children's lifestyle. So, ma'am, suppose in metro cities the children are more prone to the asthma related problem because of pollution. So
Mm.
they are more pneumologists that are seeing children. And ma'am, after post COVID, the heart patient and diabetes are more prone to these diabetologists and cardiologists. So they are elders who are going to that.
Mhm. Okay, so anyway, we can't judge because we don't know the data, right? So
Yes, ma'am.
we should check it. Okay, so so this is the question. I mean, which areas do you think should have priority in any modern health spending, like child health, geriatrics, or technology, or maybe any other spheres? So what should the government just spend money on? Yes, Prerna?
In health,
Money should be spent in all aspects, like
Yes.
if we take child health, geriatrics, technology, as we know that as the years are passing on, technology is getting more advanced. So if we get to know about the technology, then it will be useful because um, we know that the data is stored in electronic form, not in pen and paper mode. And also if in the child health can be taken as priority if as we have discussed earlier, like having some cartoons or having some colorful and playful areas for them, so that they can feel comfortable in that particular area. In geriatrics also, we have some elder patients, so uh, we can treat them and we can talk to them more about the family or anything. So we have to take care about children as well as of elderly people, as we say that they both at that time they both have same mentality, like we have to treat our elder like our child.
Exactly.
So
Okay,
so
thank
I
you.
think
Mm.
Like
yes.
as a
Can I?
doctor, we should treat them equally
Yes, I mean,
to heal them.
yes, ma'am.
Ma'am,
Ma'am,
can I?
I think there is always need to like progress in every aspect, but what I more think is technology. As we know that technology is already growing, and ma'am, when we talk about geriatrics, ma'am, it's something that, uh, for example, it's about treating old patients. So, ma'am, what is that? That in old patients, their diseases are logically, if we say that if the medicines are like invented or something, they can be treated and they can be tested more. But usually we don't take a risk on children to test medicine. So, ma'am, I think there is more need for child health, improvement in child health, ma'am. Because as we know, in geriatrics, ma'am, medicines and everything can be tested, but in child health,
Clinical trials in.
yes,
Can
clinical
I, ma'am?
trials are not.
okay. Yes, Rafael, please.
Ma'am, I think all these should be given a high priority, ma'am. But technology should be given even more, ma'am, because like we see technology, it helps in accurate diagnosis, ma'am, and even the early diagnosis, ma'am. And many a times it improves the outcomes, ma'am. Like for example, ma'am, if we innovate some products, ma'am, that can replace some of our organs, so it can help in the old people as well, ma'am. And like we used to see that there were open heart surgeries and all for uh, those cardiovascular diseases, ma'am. Now we see that due to technology, ma'am, improvement in the technology, uh, it is much easier, ma'am. Like without even a surgery, we are treating the problems, ma'am. So I think the technology should be given more priority.
Okay, great. So,
Can I?
Samhita,
Yes, ma'am. Ma'am, according to my perspective, I think just like Rafa said, that every should be given an equal priority, because that's how I think it will be better to increase the health sector in every form. But child health, ma'am, as you know, they are already less pediatric, and the number of surgeons for child, if there is a blue heart surgery has to be done, then there will be one special heart surgeon who will perform this surgery, one or two in any random small city. But ma'am,
Yes,
right
ma'am.
now, if we see according to the world statistic data, or at least if we are going to what's going in the world, countries like Yemen, countries like Afghanistan, they actually seriously need to work in every healthcare sector. So the other countries should come and forward to help them, because Yemen as of now is suffering from the world's most humanitarian crisis.
I see.
So I think
Mm,
there should be that should be done first,
I see.
and everything should be going hand in hand.
Great. Yes.
Because if there is no doctor, we cannot do anything with technology.
Mhm. And from the development of technology, any group benefits from this, right?
Yes,
Mhm.
ma'am. Almost every group will benefit
Yes,
from
ma'am.
benefit of technology, provided that the country has sufficient number of doctors.
Mhm.
Because I know there was this one city in the upper part of northeast Mizoram, that we have these anesthesia machine, but there was no doctor. There was only one doctor on 40 patients who was running hospital to hospitals.
I see.
First of all, priority should be given on, as Amita said, on the sources like doctors and
Mhm.
equipments required. If they are there at particular place, then these all can be given the second priority.
Mhm. Okay, it means that the first priority should be given to education, so to the students, right? So such students as you, because you are studying to become a doctor. Okay, thank you for sharing your opinion. It's very interesting. Well, now, if we speak about qualities of a good pediatrician, a person who deals with children. So here on this slide, we can see a table. So it shows some some positive and negative qualities of people. And the task here is to complete the table with the relevant positive and negative adjectives describing the qualities of a good pediatrician. So I mean that, so they are given in pairs, like we say, patient, and the negative form is hello,
Impatient.
impatient. Yes.
Impatient.
So I would like you to write these adjectives in such pairs. So do it individually, because we'll need them later to do the exercise. So please write them down. Just 2 minutes for you to do this. Okay. Okay, let us check. Is Arun Chalam here?
Yes, ma'am.
Will you please read all the adjectives here in pairs?
Sure, ma'am. Ma'am, for patient, it is the negative word for patient is impatient, ma'am.
Exactly.
and for diffident, that is in the bracket they have given the nervous, ma'am. So the positive word must be calm, ma'am.
Okay, confident, right? Mhm,
Yes, ma'am.
mhm.
And and the next is efficient, ma'am. So as we all know, it can be inefficient, ma'am.
Exactly. Okay.
Yes, ma'am. And then reliable, ma'am. Reliable. It is actually we can trust something, ma'am. So if we can say it is untrust or irreliable, ma'am.
Non-reliable. Non-reliable.
Unreliable.
Non-reliable,
Also
sorry.
possible. Okay.
Sensitive, as we know, it is sudden showing emotion, so insensitive, ma'am.
Mhm.
And honest is dishonest, ma'am.
Dishonest. Mhm.
And respectful, disrespectful, the
Exactly.
positive word, respectful, ma'am.
Thank you. Thank you. Great.
Thank you.
So, and well, so here are the pairs of adjectives. And if we move to the next slide, yes, here are some sentences that there are some gaps here in the sentences, and we should complete them using the adjectives from the table we have just done. So let us look at the first sentence. Madhumita, will you read the first sentence, please?
Yes, ma'am. Dr. Manzoor is very dash in everything she does. She prepares for a ward rounds methodically, and everything is where it should be and in order. Dr. Manzoor is very efficient in everything she does.
Okay, yes, efficient, yes, goes here. So this is the way you should analyze the sentences, and you should think of which adjective is missing in each of the sentences. So please, 3 minutes to you to complete the sentences. Well, are you done?
Yes, ma'am.
Okay, so let us listen to Divya, the second sentence.
Yes, ma'am.
Dr. Mubarak is a very dash sort of person. He does things quickly and often makes the parents and children nervous by showing he wants the consultation to end. Is a very irreliable sort of person.
Reliable, unreliable, or what? So, who can help us?
Here, can we use that he's impatient?
Impatient, yes. Quickly, yes.
Mubarak is very impatient sort of person. He
Yes.
does things quickly.
Okay, yes, impatient. The next sentence is for Priya. Is Priya here?
Yes, ma'am.
Yes. So, sentence number 3, please.
Yes, ma'am. Dr. Andrews is
Mhm.
very dash to all patient. He greets them properly and takes their wishes into account. For
Mhm.
that, he's very
Exactly,
respectful.
respectful. Okay, thank you. So, Prerna.
Yes, ma'am.
Mhm.
Dr. Chandra is not very attached with himself. He finds it difficult to admit his weakness while showing off his strength. Being realistic about weaknesses helps us to learn and develop our
Mhm.
skills. We can say he's not very confident with himself
Not very confident.
We can say
or reliable.
Honest,
Dr. Candu is
not
not
very
very
honest.
honest with himself.
Yes,
Yes.
maybe honest
Honest.
is better here. So, okay. Well, Nishat.
Yes, ma'am.
Mhm.
Fifth sentence. My
Yes.
colleague can be very dash. She annoyed the patients when she referred to her husband and she wasn't married. The patient was quite upset. Ma'am, in this condition, like we can use disrespectful or irresponsible. Can
Hmm.
be
Or we
very
can
disrespectful.
use insensitive.
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 Yes, also
Insensitive.
insensitive.
Okay.
Yes, ma'am.
Well, yes, thank you, Prakriti. Number 6.
It is not easy to feel the first time you do something new, but with the practice you begin to feel very good about it. Ma'am, it is not easy to feel confident the
Mhm.
first time you.
Okay, yes, good, thank you. So, Samhita, number 7.
Dr. Kamara sensed that the team thought she was dash because she let them down. She made mistakes on the ward and was late on several occasions. Dr. Karma sensed that the team thought she was inefficient,
Or
insufficient,
irresponsible.
Unreliable.
Unreliable.
unreliable,
Unreliable.
Mhm. Yes,
Unreliable.
something negative
inefficient.
way. Mhm.
Yes, ma'am.
Okay, so thank you. So it seems like we have only 1 minute left. Yes. So let us just take a break now. So